I'm Dr. Schneider, and you're suffering with leg pain, aren't you? You may have been diagnosed with sciatica. Well, one of the most important things for you to understand is there's something going wrong that's contributing to this condition. And most patients, what they do is they treat the symptoms and they try to do things to reduce the symptoms. But it's really important to understand that the symptom is there because there's something going wrong with you. And if you cover up the symptom, that doesn't correct it. And eventually nothing works to cover up the symptom. So what I do is try to discover what's causing your symptom and help you to fix that. So when we look at the leg and we look at the things that can contribute to your pain, we realize there's nerves in your leg, right? And this is the sciatic nerve. And you may have been diagnosed with sciatica. So what is that? Well, that's pain down the nerve. However, where does this nerve come from? So the easiest way to understand this nerve is like a tree trunk, and it's coming out of the ground, and these are the roots, and all these nerves come together, and they feed into this trunk, and so these nerves could be irritated or inflamed or under pressure, or there could be an imbalance here that affects these nerves. Then as that nerve travels down along its course, it travels through openings, and you can have pain and discomfort along that nerve, but the cause actually could start right here. It could be a physical problem there. So when you look at that area, one of the things you have to analyze is there some sort of degenerative change happening in that area? So we look at this spinal bone, and these are the discs right here. This is the bone, and right here is the nerve. So we look at that nerve. If that nerve's coming out of your spine, right there, that's going to be a nice healthy nerve, and you're probably not going to have leg pain or sciatica. However, we look at this level and this disc degeneration, and you can see like these fibers are breaking down. This is the gel seeps through. This is a herniation right there. So that herniation can press on that nerve, and you can see that nerve doesn't look as good as the other nerve. So that nerve can get inflamed easily, and that can be contributing to your sciatica. So you can have pressure on the nerve. That can lead into the pain that you have. Now there's a lot of muscles here too. So we can see structural imbalances in the pelvis which affect these muscles, which these muscles can get out of balance, and those muscles can tighten up and they can squeeze the nerve, and that can lead into sciatica. And then obviously, considering all of this again, you have these bones in your spine, and you can get imbalance in your spine. You can have curvatures, you can have vertebra that move out of position, and that can irritate the nerve, and that can lead to sciatica. So the way we discover that is I do a comprehensive physical exam and I identify what may be going wrong. Now, there's more to sciatica in some people than physical. Some people, they have sciatica and it's not physical at all. It's all chemical. So you have underlying inflammation that occurs in your body that can lead into sciatica. Inflammatory conditions. You can have hormonal imbalances, like some women will notice their sciatica gets worse during their menstrual cycle. So you can have hormonal imbalances. I've actually had patients who have sciatica because they have inflammation from chronic allergies that cause that nerve to inflame. So the way we discover if there's a physiological imbalance is we have you write out a health history, which is a proprietary approach that I developed to look at your whole life history to determine if there's anything going wrong leading to inflammation. And then we also have you fill out a questionnaire with 200 questions on it, and I analyze that. So we have the physical, we have the physiological. Something else that happens is there's this whole like acupuncture system, meridian system that travels down your leg, and there can be imbalances in that. So we do a very unique approach called an electromeridian analysis, and that will determine if acupuncture could help your sciatica. So we look at all of those things and we put together a very specific, unique approach to you to help correct the underlying imbalances to fix your sciatica.